Okay, guys, I have tonight's B for you. It's O's trig non onium syndrome. Okay, it's what it is double ankles, guys, for English people. For layman's terms, it's double ankles. Okay, here we go. Based on the surrounding page content, here's a detailed breakdown of how O's Trigonum syndrome develops and how it's typically managed. Okay, first, what is O's Trigonum syndrome? Definition: it's a painful condition uh, triggered by irritation or injury to an extra bone behind the ankle called the O's Trigonum. Who has it? About 15 to 30% of people are born with this bone, but most don't notice it unless it becomes inflamed or injured. How it happens: the O's Trigonum forms uh, when part of the ankle bone, the talus, doesn't fuse properly during development, injuries, or repetitive hold on guys motions like pointing toes in ballet can cause inflammation or detachment. How it occurs: trauma or overuse. It often develops from ankle sprains, repetitive uh, plantar flexion, pointing the toes, sports that stress the ankle, e.g., ballet, soccer, running, nutcracker effect. The O's Trigonum gets pinched between ankle and heel bones, sometimes referred to as nutcracker injury. Symptoms: pain during toe pointing or pushing off, okay, swelling, tenderness, and reduced ankle motion, clicking or uh, catching sensation in the back of the ankle. Diagnosis: typically uncovered through imaging when patients report ankle pain, x-rays for bone structure, CTs, CT scans for swelling, MRIs for fluid and soft tissue detail. Okay, then you go down, we've got pain management and treatment. Okay. Okay, hold on, guys. Be right with you. conservative, uh, uh, rest, ice, and modifying activity, NSAIDs or steroid injections for inflammation. Surgical treatment is bone removal if pain persists. Post op, rehab, and gradual return to activity, usually within 2 to 3 months. Prevention and care tips: wear proper fitting shoes, warm up before intense activity, um, train ankle train ankle stability and flexibility, use braces if needed, and listen to your body to avoid overuse. Would you like me to delve deeper into how this fits into your work with concussion recovery or frailty assessment? There is a fascinating interplay between biomechanical stress and long-term joint integrity. Okay, here's a comprehensive look at the surgical options for treating O's Trigonum syndrome, especially when conservative treatments like rest and physical therapy don't resolve symptoms. Surgical options for O's Trigonum syndrome: and arterioscopic, minimally invasive, uh, excusing procedure. Small incisions small incisions are made around the ankle, and a camera arthroscopy arthroscope guides the removal of the os trigundum and any inflamed tissue. Benefits: faster recovery, less post-op pain and swelling, lower risk of infection. Recovery: most patients begin gentle movement within days and return to full activity in 2 to 3 months. Okay, endoscopic surgery procedure similar to arthroscopy but less specialized. Endoscopic tools for even smaller incisions, ideal for athletes and dancers needing quicker return to high demand activities. Recovery: often quicker than open surgery with less scarring and downtime. Open surgical incisions procedure: a larger incision is made to directly access and remove the O's trigundum. When used, if the bone is large or deeply embedded. If there are complications like tendon damage or joint instability, recovery may require immobilization with a cast or boots. Full recovery can take 3 to 6 months. Post-operative care. Initial phase: rest, elevation, and limit weight bearing, usually 1 to 2 weeks. Rehabilitation: physical therapy to restore ankle strength and flexibility. Return to activity: gradual increase in mobility, athletics. Athletes often resume full performance within 3 to 6 months. Would you like to explore how these surgical approaches compare in terms of long-term joint integrity or implications for mobility in aging populations? That could tie beautifully into your work on frailty assessment and memory-friendly design, especially given your interest in tailoring interventions for vulnerable populations. Here is a comparative look at the effectiveness of surgical options for treating O's Trigonum syndrome. Based on clinical outcomes and recovery profiles, comparing surgical approaches. Effectiveness, recovery time, ideal candidate, and risk to consider. High success rate, up to 98% return to activity. Okay. Recovery time 2 to 3 months for full return. Athletes, dancers, active people. Minimal scarring, lower infections risks. Okay, comparable to endoscopy, effective for complex cases. 3 to 6 months recovery depending on joint involvement. Patients with tendon or joint pathology requires skilled surgeon, slightly longer rehab. Okay, effective for large or deeply embedded bones. 3 to 6 months longer if complications arise. Cases with structural damage or individuals, patients with requires skilled surgeon, slightly longer rehab, higher risk of swelling, nerve injury, longer downtime. clinical insights. Endoscopic and arthroscopic techniques are preferred for their minimally invasive nature, faster healing, and lower complication rates. Open surgery, while more invasive, remains necessary in complex or refractory cases, especially when the O's trigundum is large or associated with tendon damage. A systematic review found that 98% of athletes returned to previous activity levels, regardless of techniques, through or though endoscopy methods showed quicker recovery, broader implications. Given your focus on frailty and neurodegeneration, it's worth noting that minimally invasive techniques may be better, preserve joint integrity, and proper participation critical for aging population or those with cognitive decline. Reduced immobilization time also supports maintaining functional independence, a key goal in memory friendly care models. Would you like to explore these surgical outcomes intersect with post-operative cognitive recovery or mobility planning in older adults? There is a rich opportunity to connect orthopedic and neurorehabilitative strategies over the years. Surgical techniques for treating O's trigundum syndrome have evolved significantly, uh, shifting from traditional open procedures to highly refined minimal invasive approaches. Here is a breakdown of key advancements. Historical techniques. Open incision. Initially, surgeons relied on large incisions to remove the O's trigundum. While effective, this method carried higher risks, longer recovery times, greater chance of infection and nerve injury, more post-operative pain and swelling. Modern advancements. Endoscopic posterior approach technique uses two small uh, portals on either side of the arches tendon to access and remove the O's trigundum. Brief benefits: minimal scarring, faster recovery, lower complication rates, 10 to 24% for open versus endoscopic precision. Enhanced visualization allows surgeons to avoid damaging nearby structures like the flexor, uh, halcus, and longus tendon, and nerve vascular branches, bundles, endoscopy incision. Techniques similar to endoscopy, but uses a camera and shaver to remove a bone and inflamed tissue. Advantages: outpatient procedure, early mobilization, reduces need for casting. Image guided planning, MRI and CT integration. Surgeons now use uh, preoperative imaging to map out bone size, location, and soft tissue involvement. Outcome: more targeted inclusion, exclusion, and fewer surprise during surgery. Innovations in postoperative care. Accelerated rehab protocols. Patients begin gentle movement within days with full return of activity, often 2 to 3 months. Multimodal pain management, use of local anesthetics and vitamin supplementation, e.g., vitamin C, vitamin D to reduce inflammation and support healing. Relevance to broader care models. For individuals with frailty or cognitive decline, these advancements reduce immobilization time and preserve post pro proper proper uh, pro pro pre see, pro preception proprioception, key for maintaining independence and reducing fall risks. The shift toward precision low impact surgery aligns beautifully with memory friendly and mobility preserving care strategies. Okay, next page. Would you like to explore how these surgical innovations could inform interdisciplinary rehab models or adaptive housing design? Here, there's a complete system level story here. The advancements in surgical techniques for O's Trigonum syndrome have have a profound impact on rehabilitation, especially in terms of recovery speed, functional outcomes, and long term joint health. Here's how. Key implications for rehabilitation: accelerated recovery timelines, minimal invasive techniques like endoscopic and arthroscopic excisions, reduces reduced tissue trauma, allowing uh, earlier weight bearing. Quicker initiation of physical therapy, shorter immobilization periods, often just 1 or 2 weeks, enhanced functional outcome. Patients regain ankle mobility and strength faster with fewer complications like stiffness or tendon adhesions. 98% of athletes return to pre injury activity levels, often within 2 to 3 months. Dance specific rehab protocols now include pro preoperative drills and neuromuscular uh, reduction tailored to plantar flexion control. Personalized rehab protocols. Protocols now integrate uh, intertri- intrinsic foot muscle activation, i.e., toe, yoga, dome exercises. Okay, next one is balancing gait training for pros proprioception, proprioception, sports sports specific progressions, i.e., relative drills for dancers, polymetrics for athletes, reduce risk of sedentary injury, early mobilization, preserves joints, uh, preproception, which is critical for fall prevention, especially relevant to aging or cognitively impaired populations. Less scarring and inflammation mean lower risk of chronic pain, uh, altered gait mechanics. 5. Systems level benefits. These advancements support interdisciplinary rehab models. Combining orthotics or orthopedic, neurological, and occupational therapy approaches. They align with frailty prevention strategies by maintaining mobility, reducing sedentary time, and supporting independence. Would you like to explore these rehab protocols? Could be adapted for memory friendly housing or integrated into concussion recovery pathways. There's a rich opportunity to bridge surgical innovation with holistic care planning that is a brilliant direction to take this. especially given your knack for weaving together neuroscience, occupational therapy, and systematic reform. Interdisciplinary approaches to rehab after O's Trigonum surgery are transforming recovery from a uh, sold process into dynamic, patient centered experience. Here's how: neuroscience meets biometrics, mechanics, uh, pro preoperative, preoperative uh, re, reduction, leveraging system based, leveraging systems based neuroscience to retrain joint awareness and motor control, especially in aging cognitively impaired populations. Neuroplasticity driven protocols. Rehab now includes sensory motor integration drills, balance on unstable surfaces, usually tracking during movement to reinforce cortical remapping. Occupational therapy integration, functional mobility training, OT specialists guide patients through daily tasks like navigating stairs or uneven terrain using adaptive strategies that preserve autonomy. Memory friendly design, rehab spaces incorporate uh, visual cues, simplified layouts, and tactical feedback to support individuals with cognitive decline during recovery. Sports medicine and dance science, dance specific progressions, closed chain pile and reveal drills, toe yoga, and arches relaxation techniques are tailored for dancers and athletes. Uh, Functional performance testing tools like the airplane tests and triple tests assess readiness to return to high demand activities. System based rehab models in, in, interdisciplinary teams collaborate among orthopedic surgeons, neurologists, physical therapists, and OT ensures holistic care. Tech enhanced monitoring, wearables, track gait, load distribution, and joint ankles, feeding data into personalized rehab plans. anti-inflammatory diets, incorporating omega-3, curcumin, and polyphenols to reduce post-operative swelling, support tissue healing. Supplementation. Vitamin D, magnesium, and collagen peptides are increasingly used to enhance bone and tendon recovery. These approaches don't just restore movement, they preserve dignity and independence and cognitive function. Would you like to explore how these models could be adapted for frailty prevention or integrated into memory-friendly housing design? There's a powerful system levels synergy waiting to be unpacked. Okay, guys, so that is B for you. I'll be back on shortly with C for now. Gator Wellness. Take care, folks.